pain felt in the groin is likely to be coming from the hip. Pain on the side of the hip is more often from a muscle tear, and pain in the lower back or buttock is often coming from the back. If you've got significant groin pain that's getting in the way of everyday life, then that's a good indication that you should be thinking about seeing a hip surgeon. Your GP practice can arrange an X-ray film, or your GP practice can refer you in to see a hip surgeon. So I tend to ask my patients 3 questions when assessing the severity of their hip pain. I ask, are you struggling to walk half a mile on the flat? Does the pain wake you up at night? And how many painkillers are you taking? If you're needing increasing doses of painkillers, then that's a sign that you might be thinking about or should be thinking about some form of hip surgery. We're aiming to put less force through the hip joint. So we want stronger muscles and we want to control body weight. So in terms of building stronger muscles, I tend to recommend exercise bike cycling, maybe for only 1 minute per day at first. 2 minutes per day in week 2, 3 minutes a day in week 3, until doing maybe 10 to 15 minutes most days. That ensures you keep the muscles around the hip strong, taking the force away from the hip joint and quietening down the inflammation within the hip. If your weight's in the right place and you've kept your muscles strong, but you're still getting significant groin pain, then that's the time to seek out further help.